my name is Miss Renee Richards. For those of you who have never yet seen my face, my channel is all about motivation, staying determined, and all things for the love of dentistry. So from the title, this is another dental related video, and it's just an informative video of how to become a dental hygienist slash therapist here in the UK. So if you want to go get your notebooks out and your pens, go and do so now, and let's get into it. There seems to be a mystery around what a dental hygienist and therapist does. I explain it to people who ask me, oh, what is it that you're studying, and what will you be at the end of your qualification once you're qualified? I just say to them that we are pretty much hands-on like a dentist, but there's certain things that we cannot do, which we have to leave to the dentist to do. If you love dentistry, want to get a foot in the door, you want to be hands-on, maybe don't want to be as hands-on as a dentist, or don't have all the qualifications to become a dentist, but really want to play a vital role in the patient's care plan, becoming a dental hygienist or a dental therapist would suit you well. First of all, let's clear up the difference between a dental hygienist and a dental therapist. A dental therapist can do everything that a dental hygienist can do, but there's certain things that a dental therapist does that a dental hygienist cannot do, unless they have the dual qualification, or they go on to, unless they have the dual qualification, or they, go on to expand their scope of practice. So the dental hygienist and therapist will focus on preventing and treating gum disease. So just looking on the General Dental Council's website for the scope of practice of a hygienist, let me give you the breakdown. A hygienist will complete periodontal examinations. They'll do charting and use indices to screen and monitor periodontal disease. So they'll do like your 6-point pocket charts, your plaque score, your bleed score. They will prescribe for radiographs to be done. They'll take, process and interpret various film views used in general dental practice. They will also plan the delivery of care for patients. They undertake subgingival or supragingival scaling and root surface debridement. I hate saying that word. So subgingival and supragingival scaling is literally scaling above the gum and scaling below the gum surface as well. What else can they do? They can apply topical treatments and visual sealants. They will also give patients advice on how to stop smoking or smoking cessation. They'll take intra and extra oral photographs, and there is a full list here of what a dental hygienist can do. And again, as I said, what a dental hygienist can do is the same thing that a dental therapist can do also. Now, with a dental hygienist with extra training, they can do a little bit of teeth whitening to the prescription of a dentist, and they can also remove sutures after the wound has been checked by a dentist, and also administer inhalation sedation. It clearly states here that dental hygienist does not restore any teeth, they don't carry out any pulp treatments, they don't adjust any unrestored surfaces, and they don't extract teeth. I will leave the link in the description box to the General Dental Council scope of practice website, where you can read fully exactly what a dental hygienist can carry out and what they can't carry out. As I said, a dental therapist can do what a dental hygienist do, but there's a little bit more to that. According to the website, dental therapists, they can carry out pulpotomies on primary teeth. They can extract primary teeth. That's like your baby teeth, your children's teeth. They can carry out direct restoration on both primary and adult teeth as well. They can care implants and treatment of peri-implant tissues. What else can they do that a dental hygienist cannot do? I think in a nutshell, that's really it. They can, go in and give fillings. They can do extractions. Again, they can carry out tooth whitening to the prescription of the dentist, remove sutures after the wound has been checked by a dentist, and administer inhalation sedation. Whereas a dental hygienist will focus on, again, preventing and treating gum disease, the therapist has a little bit extra to do. They can do certain things that the dentist can do, such as extracting teeth. Although they can't extract adult teeth, they can extract baby teeth, children teeth as well. They can go in there and do a bit of drilling around in the teeth and apply fillings as well. This sounds like something that you would enjoy. Let's talk about the qualifications that you will need to become a dental hygienist or a dental therapist or dental hygienist / therapist. Now, unlike dental nursing and becoming a dental technician, there aren't any form of apprenticeships to becoming a dental hygienist or a dental therapist. You will have to go to university, as there isn't even a BTEC course for this. It is just straight up a degree program that you have to undertake to become this kind of a dental practitioner. Traditional entry requirements would be your GCSEs alongside your 2 to 3 A levels. If you do have a dental nursing qualification, you can use these alongside whatever other qualifications that you may have, whatever A levels you may have and GCSEs. If you do have the dental nursing qualification but you don't have any A levels, you will have to do an access course to work in alignment with this. For myself, that's what I had to do, because I didn't have your traditional qualifications. I had to undertake the access course. Once I did the access course, I lacked self-confidence. I do believe that if I'd applied at the time to do dental hygiene and therapy, I would have got on with my grades that I got from the access course. But again, as I said, I lacked confidence. So I did the dental nursing course at Teesside University, and I gained that qualification, and I used that along with my access course qualification to apply for the dental hygiene and therapy course. So again, if you don't have traditional qualifications and you're a little bit older in life, please don't be disheartened and don't think that you can't achieve your goals because you ain't got your traditional qualification. Do the best that you can and use your grades and your qualifications from there to then apply to the dental hygiene or dental hygiene and therapy program. So now that we've got qualifications out of the way, where can you study in the UK to become a dental hygiene and a dental therapist? Now, unlike dental technicians, there are not so many institutions across the UK that does offer a dental hygiene or a dental hygiene and therapy program. And because of that, obviously competition each year is pretty stiff. When I started first year, our lecturer was telling us that I think maybe about 400-500 people applied for the course, and there was just over 30 places offered. So competition is really, really, really stiff. However, there are, again, as I said, a few universities, a handful of there are a handful of universities that does offer this course. Most of them are 3-year course. However, you do have a few universities, I think the ones that just offer the hygiene, that they do just a 2-year program. And I think University of Essex does a 27-month program, starts in January and not September. Again, I will put full links in the description box for those of you who are interested, can check it out and get a lot more information and details from the UCAS websites. So, the University of Cardiff does a 3-year full degree program. I'm looking at my list here. University of Portsmouth does also a 3-year program. University of Cardiff does both a dual qualification, which is dental hygiene and therapy, and they do a dental hygiene course. The dental hygiene is 2 years, the dental hygiene and therapy is a 3-year qualification. University of Portsmouth also does the same dual qualification and the hygiene program. I think both of which are 3-year courses. University of Birmingham does a dual qualification, again another 3-year course. Looking at my list, University of Leeds does a dual qualification as well, and Teesside University does the dental hygiene program, which is again another 3-year program. Again guys, I will put the link in the description box that you can check out all the institutions that offer both the dental hygiene and the dual qualification courses. No one is going into a profession without knowing how much they will be earning. No matter how much we say we love dentistry, we all want to know, once we are qualified, what is the potential earning amount.
Especially with this living crisis, everyone is legit defending their coins at this moment in time.
As a starter hygienist, you are looking at around £25,654 per month. So let's draw for the calculator, guys. 5,654 divided by 12. So we're looking at not those figures. So we're looking at roughly around £2,137 per month. Not bad. It's all right. You can live. You can pay your rent or pay your mortgage and you can live. An experienced dental hygiene is looking at roughly around 40 grand per year. So that works out to be roughly around £3,338 per month. Again guys, these figures are not set in stone, and as living costs rise, I'm sure wages are supposed to rise as well. But these wages are also dependent on, you know, if you're working for an NHS practice or you're working privately, if you're doing locum, if you're a locum hygienist as well, if you have your own clinic, all these things will come into play and will increase your wages as well. Now let's look at a therapist. Now a dental therapist starting off is looking at around £27,055 per year. So that roughly works out to around £2,254 per month. Again, not bad as a starting off height therapist or someone with the dual qualification. An experienced dental therapist is looking at roughly around £40,558 per year, and roughly per month that does work out to be £3,382. I did do some calculations before, so they are in front of me, but again, not bad at all for this line of work. Personally, I do know clinicians who are working and earning a lot more than this. Clinicians who have just left uni as well, they are earning a little bit higher than this. So again, as I said to you guys before, you know, the wages aren't set in stone, and if you do things to sort of expand your scope of practice, that will obviously impact your wages as well. That leads me to my favorite topic, progression. Guys, if you've been watching my previous videos, you know that I am a big firm believer in progressing, not standing still, pushing yourself to achieve all that you can achieve out of life, not holding back, and, you know, just really going out there and giving life the best that you can. So dental hygienist, after qualifying, you do not have to stay as just a dental hygienist. Many people do go on to doing a post-grad course in dental therapy in order that they can gain the dual qualification and expand their scope of practice. Of course, that brings more of this, but it also allows you to do a lot more than you started off doing, which is fabulous. Hygienists can actually go on to opening their own clinic and hiring dentists to work alongside them as well for certain treatments, which I think is absolutely fabulous ideas. There's a few guys on my course who is talking, they have said that this is something that they are looking to do. So yeah, if this is something that you are interested in, don't think that because you're a hygienist that you can't go out and set up your own practice. You can certainly do so. I know many hygienists as well and many therapists who starts to dabble and gain experience in the world of aesthetics and fillers and Botox and beauty treatments. They are combining, you know, the aesthetics with the dental treatments and giving their patients this combo package, and they're doing really well. So if beauty is something that you are into, again, it is something that you can look into going into once you're qualified. And again, trying to open up your own practice or working in a practice that will allow you to bring those treatments in as well. With therapists again can go on to doing other post-grad qualifications, again to expand their scope of practice, and they too can also open up their own dental clinic. Guys, what I love, and I think I've said this in all my previous videos on this topic, is that dentistry in a whole, there's so much room for progression, there's so much room for growth. Being in this profession, literally no 2 days are the same, no 2 patients are the same, and I can attest to that being on the dental clinic at uni. No 2 patients that I see are the same, and that is what gives me my buzz and my drive. You don't know who you're going to be treating, you don't know what they need, and being in their mouth, it's so interesting because everyone's mouth has a different complex to it. I don't know if that makes sense, but it's really intriguing to see, literally being in people's mouth. Literally, guys, there's something about being in people's mouth. It's great, it's really interesting, and it's really intriguing. So again, if this is something that you are interested in, please go ahead, chase your goals, chase your dreams. You will not regret it at all. You know what's the most satisfying thing with being on the dental clinic now is that there's the little smiles that patients give you once you've done the treatment, and you can genuinely see that you have actually made a difference in their life. You've made a difference with the thing that they have to show off every single day, whether they want to or they're not, and that's their teeth, it's their smile. And I think a lot of people don't realize how people lack confidence when their smile and their teeth is not up to top form. And if you can give someone their confidence back just by you, and you don't even realize that you can start to give people their confidence in their smile just by literally 1 session of treatment. And I'm telling you guys, if you have an interest and a passion for teeth and being in people's mouth, then dentistry is for you. I hope this video has been a blessing to you and has given you an insight into the world of dentistry. If you know someone who this video will inspire, please share this video to them, that they can go on and apply to becoming a dental hygienist / therapist. Now guys, you can connect with me over on social media. I cannot remember my Instagram name for the life of me, but I will put the link in the description. Also guys, I know a lot of you recently have reached out to me regarding your statements for UCAS. If you need any form of help one, you can reach out to me on IG, or you can also reach out to me in my email. Again, I will leave my email address in the description below. Again, guys, I hope this video has inspired you to go out and becoming a dental practitioner. I love you all, and thank you again for all your support, and I will see you guys in my next video. Take care, guys. God bless you all.